Periods are natural, conversation around them should be too. This Menstrual Hygiene Day, Radio City and Team Alembic, the makers of Krina NCR, invite you to join an open discussion on menstrual health, hygiene, and understanding your body better.
Hello and welcome to the Period Talk with Experts, a special podcast series where we talk about women's health openly and honestly. Because understanding your body should never feel uncomfortable. I am Aditya, your host, and today we are discussing something that affects every woman, yet is often surrounded by myths, hesitation, and silence: menstrual health and hygiene. Joining us today is SAYAMSTUTI Pattanaik, a practicing gynecologist with years of experience in women's health. Doctor, welcome to the show.
Thank you. Thank you for giving me this opportunity to speak about periods, something which is a taboo in the society, and about women's health, the various menstrual issues, and the concerns and myths related to it, so that women can understand themselves better and take help for making their lives better.
Doctor, one topic which women hesitate talking about is heavy bleeding. Sometimes women think this is just how my periods are. So how do we know if bleeding is heavier or normal?
So periods can vary from a woman to woman in quantity, in days, in duration. There's so many other factors which can amount to calling it a heavy menstrual period. Women can be cautious when they have period for a longer period of time, maybe more than 7 or 8 days, or they are changing frequently pads in a day, more than 7-8 pads, or they feel that they're losing a lot of blood, or there are some kinds of clots associated with it. So heavy menstrual bleeding will amount to the volume or the amount of blood that they're losing. The pads they're changing can be an indicator of that. The number of days which they're having the periods for, and whether in a month they're having it more frequently or so. Those are the few factors which can be called as a heavy menstrual bleeding. So what we consider normal is 2 to 8 days of periods, minimum 3 to 4 pads a day changing and without clots. That is what is standard or a range. Something beyond that can be considered a heavy menstrual bleeding.
Doctor, apart from periods, what are some other gynecological concerns that women should not ignore?
Okay, so period is something which a woman is always concerned about if she doesn't get it every month in a proper amount, quantity or time. But besides that, there are many other danger signs or red flags, what we call, which women usually ignore, which can accumulate and can be a cumulative problem later on. So there are a few things which are common problems, not very uncommon or rare, which a woman faces on a day-to-day basis, starting with infections in the vagina, vaginal discharges, mixed infections, fungal infections, what we call as vulvovaginal candidiasis or vaginitis, or things which can later lead to a lower abdominal pain or any pelvic inflammatory disorders which can be even sexually transmitted. Otherwise, due to poor menstrual hygiene, usually people come with leukorrhea or white discharge PV associated with itching. That is a common problem which women have, and they ignore, and only when it is severe they come to us. Associated with urinary symptoms like burning sensation while passing urine, or a frequency of urine or urgency of urine. So these are a few things which women should promptly come and seek help from the doctor and get themselves corrected or treated, instead of ignoring them like it's okay, it's a simple white discharge or a simple itching or something like that. Besides that, any other pain, pelvic pain, or whether it is acute or chronic, or it's coming in intermittent, or during periods if somebody is having excessive pain, that can be a concern, that can have an underlying condition. Those are the few things which we should take care of it. Besides that, when it comes to other symptoms like mood swings, emotional disturbances, weight gain, or they feel they're bloated, or retention of water in the bodies, any pain in both the breasts, these can amount to a few hormonal issues in the woman. There are certain diseases where I won't call it diseases or lifestyle disorder conditions like PMOS is the new name for PCOS, like polyendocrine metabolic ovarian syndrome, which is very the hot topic nowadays because it's on rise due to the lifestyle changes. That is something which in our regular OPD, besides the vaginal infections, that is what we see every now and then with irregular cycles. So keeping aside the period part, if they have any skin changes like a lot of acne or hair loss or water retention or weight gain or skin changes, these can also be due to the underlying endocrine or metabolic disorder amounting to PMOS. So these are a few things which can be kept in the mind, summarizing as acute or chronic pelvic pain otherwise, any urinary problems, any vaginal infections, or as I said, any other skin changes or associated disorders which can also be associated with this. Also, even if a person or a couple is not trying to conceive or something, there can be something as counseling about reproductive life or preconceptional counseling. So that can also be something which they can come and discuss and know how healthy they are, and prevention is better than cure. So any issues regarding the reproductive concern, maybe having regular cycles, but that should also be discussed. And breast is another very, very important thing. Any pain, lump, mass or any issues regarding the breast should not be ignored.
Alright, doctor, let's do a quick myth versus fact round. So there is this myth 1: women should avoid bathing during periods.
No, absolutely not. This is something, a social taboo which has been happening, that women should not do this, should not touch God, should not take a bath, should not go to the temples and this and that. Keeping the religious and spiritual part aside, and no comments on that, a woman's hygiene during that period is the most important one. So a woman has to take bath as she does on any other day, and periods should not be an exception in any circumstances. Under any circumstances, there is no reason for stopping any of her day-to-day activity, and rather more hygiene is required during periods.
So the myth 2 is severe period pain is always normal.
Okay, severe period pain is not normal. Yes, it may not be due to any organic pathology, it may be just a congestive dysmenorrhea, but I think quality of life also matters. There are two segments. Even if it is just a congestive dysmenorrhea, if the girl or the woman is not able to carry out her day-to-day activities or go to school or carry out her household chores or do her job, then definitely it is a matter of concern and not to be ignored. She can take the help of a few medications and make her day better, her job better, her life better. And also she has to be evaluated by the doctor to know if there is any organic pathology or any underlying disease which is causing that pain, and not just the usual congestive dysmenorrhea or the non-organic pathology reason. So that has to be evaluated and known from the doctor, and accordingly she has to be treated and known, and she has to understand what are the reasons and what may be the reasons for this thing, and she can make her quality of life better.
Okay, the myth 3 is heavy period is something women should normally tolerate.
Okay. Usually that is what happens in our society. It's not alarming from them. As I said, unless and until there is a lot of pain, a lot of bleeding, women are not concerned. And we see patients for 7-8 months or a year, they'll be having heavy menstrual cycles only when they'll be having severe anemia or a lot of weakness, fatigue. That is when they turn up with the doctor. So absolutely not. Yeah, one cycle, if you're not concerned, that is okay. Maybe if it is repeating in the second cycle, third cycle, you have to go to the doctor and get yourself evaluated and treated and managed so that you don't lose blood, and as well as you treat the issue which is causing heavy menstrual disorder.
The myth 4 is talking about menstrual health is absolutely inappropriate.
Okay. No, menstrual health is something which is the most important element in a woman's or a girl's life. So the more we talk about it, the more we normalize and generalize it, and the more we are not ashamed of it or hide it, I think women are gonna flourish or prosper in a better way. Men have to generalize or normalize it more than women do. But I feel in our Indian society, it is the women who are ashamed to talk about it. They don't want to openly discuss issues. Even the period packets or the pads are hidden, in a black polythene or a newspaper. I think that all has to stop, and things have changed. It is not as it used to be. Everyone is talking about menstrual health, menstrual hygiene, disorders, or the nutrition associated with it, and various other things. So I think the more and more it is normalized, like, the men's issues are normalized, so women's issues have to be normalized. And period is something which is a physiological thing in a woman's body, like we urinate or we pass stools. It is just something like that. So why somebody has to be skeptical about it or ashamed to discuss issues regarding menses?
Okay, doctor, thank you so much for this. Before we wrap up, what would be one single message you would like our listeners to get?
Yeah, out of all the messages which are important for women, all I would want to tell them is just be true to yourself. Try to recognize what's the issue in your body, starting from mind up to your toes, whether it's your skin or your menses or your hormones or any issue from top to bottom. I think the body is a circuit. It's all connected with each other. We can't segregate something as a menstrual issue or a gynec issue or a non-gynecological issue. So go to your doctor, have a word, and just don't Google and try to acquire a little information, because less information is harmful. You should have a complete this thing in front of you, which the doctors can help you and serve you better. So just be true to yourself, be aware, be vigilant, and be happy and be healthy.
Thank you so much, doctor, for this practical and such an informative discussion. And to all our listeners, your health matters, your question matters, and seeking help is always a sign of strength, not hesitation. And that was Menstrual Hygiene Talk with SAYAMSTUTI PATTANAIK. Thank you so much.